So here we discuss the case of a 29-year-old male who presented to the emergency department with right groin pain and swelling. He had recently been incarcerated and was told he had an inguinal hernia, and then when he got back to his sober living facility and had intercourse with his girlfriend, he started noticing increased swelling and pain to that area, prompting him to come to the emergency department. Everything on exam pointed to this possibly being an incarcerated hernia, so a CT scan was obtained. This CT scan showed that there was a heterogeneous mass-like process in the right inguinal area, and the reading was that this was more consistent with a hematoma or a soft tissue mass than it was a hernia. General surgery was consulted, and they believed that this was a spontaneous rupture of an inferior epigastric artery aneurysm. The patient was treated conservatively with warm compresses and was sent home. Looking at the literature available for spontaneous rupture of inferior epigastric artery aneurysms, there does not appear to be consensus in the literature as far as if conservative or surgical management is warranted. However, most patients seem to present are typically taken for surgery. And however, there are some cases in which conservative management is warranted, which we believe in this patient it was, as he was stable and the mass had not grown in size in the amount of time he was in the emergency department. There are some interesting things to note about inferior epigastric artery aneurysms that help distinguish them from other right inguinal masses. And all of this leads me to present this as a case report because it was a unique presentation that turned out to be different than what we thought it was originally.